a renowned neurosurgeon and Chairman Managing Director of Ananthapuri Hospitals and Research Institute in Thiruvananthapuram. He has an extensive background in the field of neurosurgery, has effected pioneering innovations in clinical neurosciences. In addition to his clinical work, he has held and still holds significant leadership roles contributing to the advancement of medical research and healthcare services in Kerala. Dr. Marthanda Pillai, it is my pleasure to invite you to take over the floor for the session and to introduce your fellow panelists. Over to you, sir.
So, a very good afternoon to the distinguished panelists and distinguished delegates. At the outset itself, let me appreciate and place on record my appreciation to the Trivandrum Management Group for taking this issue of One Health for a session, because it is very, very important from whatever has been already discussed, that even the survival of the human race depends upon how fast and how effectively we take up One Health. And now these eminent panelists during this session will be deliberating on epidemics, pandemics, prevention and preparedness. That will be the topic that we are going to deliberate. And as a small introduction, let me say that epidemics, pandemics, it is not something new. From the very existence of the human race, this has been there in different dimensions. And of course, the knowledge, epidemiology, and the progress of all these things is better known now than before. To begin with, it has been shrouded with mystery and things like that. And only very late and gradually the realization that this happens because of organism infecting the human being. But then if you look at the whole scenario, whatever has been laid down as a protocol for tackling epidemics and pandemics still remains the same even today. Even during the Spanish flu in 1918, isolation, social distancing, wearing of the mask or gloves, sanitation, and things like that still continues to be the basic principles for tackling epidemics and even pandemics. And we have even recently seen how these have been utilized for tackling COVID-19. But then the main advantage or advances that has happened is that vaccine, even before vaccine have been just the main remedy to tackle these infections, and we have successfully eliminated at least few of them like polio and chickenpox and tuberculosis, of course, we are trying to. So the role that vaccine plays definitely is very important, and as far as COVID was concerned, we could normally, to have a new vaccine, it takes almost 2 years or more, and we had to spend 2 crores or more, 20 crores or more for that also. But here we have shown that in 6 months, we could have a COVID vaccine, not one vaccine, different vaccines, utilizing different technology, and that too very successfully in building herd immunity. And but then the negative aspect of the epidemic was that the weakest of the society have been the most sufferers, and those who are better off could sort of live with it. And this is one aspect that definitely we have to address, because only when everybody is safe, you are safe. So without taking into account account the health of the whole population, we cannot have solutions for all these issues. And it also exposed the weakness of the health preparedness and health system in our country and even world over, where even very prosperous advanced countries could succumb to the pressure of non-availability of proper health care systems. And also, another aspect was how early you have intervened. Those countries which intervened very early with COVID-19 had less mortality and could control it better, like China, Korea, Hong Kong, and many other countries. And in England, of course, it was very slow to start with, and definitely the mortality and morbidity has been higher in that country. Our preparedness and the steps that we have taken for control, although they are time-tested methods, how it has been done, how effectively we have done it, whether our decisions in doing it has been right or not, definitely are subjects which ought to be subjected to much more study and research so that we can evolve better methods. Even in Kerala, we have seen that we have been very fast in implementing the time-tested methods to contain COVID-19. The public health initiatives have been very fast. But we have seen that, is it because we have been very effective in implementing lockdown, or whether it is the health consciousness of our population which made it more effective? But the result has been that when the antibody levels of the populations were taken, we have found that it has been much less in Kerala than in other states. So over-enthusiasm in lockdown, extension of the period of lockdown, whether it has done good or bad, are things which has to be subjected to critical analysis, because at least next time we could be more careful in doing that. And even the herd immunity level we could achieve only late, in spite of having a relatively good health system and a population which is health aware, and the government, it has been very effective and efficient. These things are happening. So these are matters which definitely has to be subjected to further analysis and study. Even other epidemics or endemics, even the bird flu, which is happening like a ritual every year in Alappuzha, we have not been able to decipher why it is happening. But in America there has been a similar situation, and some of the studies show that the antibody of avian flu has been detected in cow milk. So whether the cow is an intermediate host for these repeated episodes of what, all need much greater study to come out with solutions. Even the Hippo virus, where the bat is the culprit, these bats can harbor almost 600 species of organisms, and they survive in the bat without doing harm to the bat, particularly because of the body temperature of the bat. And why this is happening and how the infection is repeatedly coming again are matters which need detailed study. So there are a lot of issues with modern technology, digital health and advancement, artificial intelligence and all. Whatever information we can collect from this COVID epidemic has to be utilized properly so that further epidemic, we cannot prevent epidemics, we can't even predict it, but then at least you will be prepared to handle it in a better manner, particularly with technology advancement. But when you analyze all these epidemics which have been happening, infectious diseases that have been happening time and again all over the world, the data shows that 70% of these infections are contrived from animals. And if out of this, another 70% of this is from wild animals. So the need for a relook at wild animals, environment, and human health is very important. And One Health, we have at least 15 lakhs of doctors from the different streams and 2 or 3 lakhs of hospitals, including primary health centers, more than that. But if you look at the veterinary sector, there is only 7,500 institutions, including mobile hospitals and all, dispensaries and all. And the number of veterinarians are hardly 750 or so. So for the equal population, the healthcare dispensation is so extremely different that it needs address. Particularly because the human race, particularly the sub-Saharan population, depend on animals for their food, nutrition, for travel, for hobby, and as pet and whatever. So the importance of animals is highlighted just by looking at this fact alone. And AMR, already the previous speakers have pointed out that One Health, again, is a concept through which the AMR can be addressed. If you don't address it, antimicrobial resistance, we will be going back to a period where we didn't have any antibiotics, because whatever antibiotics we have now may not be effective for subsequent infections that are going to come. So we'll be going back to the dark ages where there was no antibiotics and infection will rule. And even the human body, if you look at it, the microbes in our body is more than the number of cells in our body. So, because of some sort of symbiosis, the human being is living, but when there is a drop in resistance, some of these organisms become pathogens and take the toll. So the One Health aspect has to be definitely addressed, and there is a beginning to this, and Trivandrum Management Association should not stop it with this symposium or this conference, but take the lead to see that it is effectively addressed within the financial resources and the manpower we have, so that periodic interaction with environmentalists, activists, veterinarians, modern medical doctors, and administration to check out a plan, sustainable plan within our resources is the need of the hour. We have already seen that intrusion of animals into the population and the havoc it is creating, particularly in highland areas. And that is only one aspect of it. So I am not going to deliberate more on those aspects, but these are the issues that are to be addressed. And we have a panelist here who will be deliberating on some of the issues and finding solutions as to how best we can go ahead with this short introduction. I will invite our panelists to deal with some of the topics which will throw more light as to how best we can take this initiative forward. So I will begin with Aravind, and one topic which I would request him to take up first is how can early detection systems be enhanced through a One Health approach to better predict and manage future outbreaks.
If we take the Kerala experience, how we dealt with Nipah and how we dealt with COVID and monkeypox, so that in itself gives an answer to Sa's question. So how should we be dealing with a pandemic or an epidemic? There are two approaches. So one is the preemptive approach and second is the reactive response or the firefighting. So Kerala, as we all know, are the leaders in firefighting. So if there is a fire, then all of us join together, how we tackle the floods, etc. So that is exactly what happened during the 2018 Nipah. So we were able to identify the case, the second case. And then from the index case, 19 others got infected and the mortality rate was around 90%. So we were not able to prevent it from happening. So what we were able to do was to contain the Nipah outbreak from spreading to the further people. That is what happened during the last year's Nipah outbreak as well. So this is a reactive response. Ideally, we should be having a preemptive response. Preemptive means that's a bit more difficult. We need to have a lot of epidemic intelligence. We need to predict what is going to happen like that. For example, as SAR said that during the ICMR zero prevalence service, it is clear that the bats in all the districts in Kerala as well as in 12 other states in India harbor antibodies against Nipah. That means that the spillover which is happening from the bats to humans can occur anywhere in India. That's the meaning. It's only that Kerala is able to diagnose these infections at the right time. So epidemic intelligence basically means that we need to have a continuous surveillance system in bats regarding when these antibody levels are coming down, when this viremia is occurring in bats, and we should be able to identify the hotspots. When it came to COVID-19, so we were able to diagnose the first case itself because we knew that when this outbreak of a novel coronavirus is happening in Wuhan, so we contacted NORCA and realized that around 700 students are studying in the Wuhan University. So that is one of the epidemiological vulnerability of Kerala. That is recently data showed that except in North Korea, we have Malayalis everywhere. And by nature, when they get infected, they will get on to the next flight. In 24 hours, they will reach here. So Ebola means outbreak in Nigeria can reach our airport within say 24 hours. That is true with Lassa fever. That is the biggest threat that the Kerala faces. Second is with relation to the guest workers we are having. We have around 30 lakh guest workers and malaria and Kala-Azar etc. which we thought that we have gotten rid of these infections have made a strong comeback. That is second challenge. Third is the density of population. Our density is twice that of the national average. And from Trivandrum to Kasaragod, it is just like a metropolitan. So an infection here will reach Kasaragod within say 3 to 4 hours. That is another challenge that we are facing. And another problem is our life expectancy. Life expectancy is a huge problem. So we should not be saying life expectancy is a problem. But Italy had a problem with COVID-19. Spain had a problem. Why? Because their life expectancy was more than 80. So if you are having more of people above 80, the chance of them succumbing to these sort of emerging infections also high. That does not mean that the Italian health system or the Spanish health system is inferior to our health system. That just shows that their health standards are so high that they have more vulnerable population in the society. And as a civilized society, it is our responsibility to protect them also. That is what is meant by this vulnerability mapping. So when we did the vulnerability mapping in Kerala, we had 46 lakh people above 65 years in Kerala. So that is the reason why when we compared with the rest of India, we need to go with this aggressive lockdown strategies and all those things for close to 1.9 years. We waited for more than 90% of our elderly population to be vaccinated. Then only we opened this society to we withdrew this non-pharmacological interventions. So basically, in order to practice this preemptive response, we need to focus more on epidemic intelligence, like what infections are going on in what part of the world. We need to have a very good airport tracking system. A person coming back from say Sierra Leone with fever and jaundice, we should be able to pick them up. We need to isolate them before the infection spreads in the community. That is exactly what we did with COVID-19. When these students returned back from Wuhan, so we quarantined them, and when they developed this fever through our public health system, we were able to isolate them, test them, and diagnose the first case of COVID-19. When we look at monkeypox also, the first case of monkeypox in India was also diagnosed by Kerala, and this person returned back from Dubai. And incidentally, out of the 10 cases of monkeypox diagnosed in Kerala, all of them had returned from Dubai, and we consider Middle East as an extension of Kerala. So what we do is we look for outbreaks in Middle East, and an outbreak occurring in any part of Middle East means that that infection is going to come to Kerala within a couple of weeks. And that is basically the crux of epidemic intelligence. So with this epidemic intelligence, we will be able to plan preemptive response. If we are able to identify the first case of an emerging or a re-emerging infection, the ability for us to control that outbreak is going to be huge. So instead of reactive response, we should be practicing more of this preemptive response. For that, epidemic intelligence is very important. As Dr. Pradeep said, majority of these emerging infections are zoonotic, and about 75% has origin in this wildlife. That is the real challenge of One Health. One Health has to be, in order to practice One Health, lot of departments need to come together. It's not only the health, the animal husbandry, the dairy, the fisheries and aquaculture, environment, pollution, all of these need to work together. And that is going to be the biggest challenge. As far as AMR is concerned, at the national level, around 11 ministries need to work together to come out with an action plan for AMR. So basically, my take is that, epidemics and pandemics can occur at any time. So we should be able to predict that from happening. Only then the mitigating strategies will be successful.
Thank you. Now I will request Group Captain Professor Dr. Hemant Madan, VSM.
This is the first management conference that I am ever attending which deals with the healthcare topic. Normally I have never attended, or I have never seen management people talk about healthcare in such a focused manner as this. A pandemic, we must understand, all pandemics, all diseases, we must remember, are essentially management and logistic problems as well. They are medical problems, all right. Their medical scientists need to come up with solutions, but it's essentially also a logistic and a management problem. I'm sure most of us remember, while we were going through the pandemic, most of us remember trucks of oxygen cylinders being held up at borders because of various political, issues, oxygen not reaching people in time, and therefore people succumbing to this. Regarding prediction of how we are eventually going to be managed is only by one of the previous speakers' slides, which very clearly showed that as long as we are aware of our environment, as long as we are aware of what's happening around us, only then will our warning signals go up. Is it ever going to be possible to devise a test, a blood test, which will diagnose diseases across humanity? No, I don't think that will ever be possible. We will never have a single test which will be able to detect, which will be able to diagnose, and therefore diagnosis is going to come only by way of epidemiological sharpness, epidemiological astuteness, understanding what's happening around your society. If there's an unaccustomed increase in the number of patients who are having fever, or people, or even going further down in animal deaths in societies where people stay with animals, that's possibly going to be the first indicator for a pandemic. The second indicator, which the second aspect which I really want to highlight here, which is something which we still haven't learned from the COVID pandemic, is getting a basic level of awareness about infective diseases and about pandemics across the general group of doctors. Not only, I'm not talking of only of human medical doctors here, I'm even talking of our veterinary colleagues. I don't think we have yet devised a course or a strategy. See, what happens is, as the health secretary mentioned in his talk, unfortunately healthcare has taken a turn where everybody has become a specialist, a super specialist, and with the private sectors investing so much money, a super specialist. We have people who only talk of, in my specialty, only talk of heart failure, only talk of congenital heart diseases. So and there are plenty of such doctors. Now, if there was a pandemic like what happened in COVID, are we ever going to integrate these super specialists, get them down to basics and integrate and utilize their services in healthcare? I don't think we have yet got a integrated approach for this. So this is something that I suggest very often, and this is something that is possibly this is a good forum to suggest this as well, is that some basic level of awareness of the pandemics happening across the earth or across the world should be made aware even to super specialists, even to specialists who are very focused in their private sector, so that we are on the same page should a pandemic or should an epidemic strike. The 1991 WHO theme was, of course, it was not related to a pandemic, but it was, should disaster strike, be prepared. Now, as my previous panelist spoke, we cannot be in a reactive mode to respond to disasters. We have to be in a preparatory mode to respond to disasters. And therefore, the only way is to be aware and to be prepared of these disasters. In the intervening period between say 1990 and till very recently, we thought communicable diseases were going out of our kind of stress list, and we need to be more focused on non-communicable diseases. Epidemics were talked about more in terms of obesity, diabetes, heart disease. Those still remain a problem, but COVID-19 has provided a very strong reminder to the entire humanity that communicable diseases are not going anywhere. In fact, with the man-animal conflict, human-animal conflict, communicable diseases will be there, and we better kind of remain sharp with our clinical judgment on this particular aspect. Finally, a thought about, again, what the previous speaker said, let's not be egocentric, let's be eco-centric. That's a thought which is the backbone of One Health. For those of you who are interested or who read some alternative books other than professional books, there's a book written by a very prominent author called A Brief History of Almost Everything. This is by an author called Bill Bryson, where he talks about the entire living being. And what he says is that if we were to take the entire living kind of planet as one day, that means as 24 hours, human beings actually came into existence only at 11:59 p.m. So that means in the entire history of the world, we've been around for only 1 minute of that entire history. So it's impossible for us to feel that we are the most important being, and therefore we can do whatever we feel like. No. If we don't behave the way we have, if we continue to behave the way we've been behaving, naturally nature is going to strike us, and nature can be ruthless, as was shown very briefly during the COVID pandemic. Thank you.
I pose him with this question: which aspect of human health has been most impacted by recent epidemics, and how can these effects be mitigated?
At the outset, let me thank Trivandrum Management Association for having me here. So the question is, what aspect of human life has been impacted by COVID-19? My question will be, what has not been impacted? Although COVID-19 taught us a lot of stuff, most important thing it taught us is health care. One disaster, one pandemic can affect not only health, it can affect economic, social, educational, every aspect of human life. I am sure of the 150-200 people who are sitting here, not a single person was not affected by COVID-19 in one way or the other. There were lockdowns. Social aspect was health aspect was the maximum, I think. If you look at the mortality figures, 50 to 60 lakh people in our country has died. These are not official figures, but these are the studies which have shown. If you look at the previous pandemic, 1918 pandemic, it almost wiped out 5 to 7% of world population, 5 to 7%. COVID-19, the mortality figures are much, much lower. It is less than 0.5 or 0.2% of world's population, or even lesser, thanks to modern technology, vaccines, and the way we responded to pandemic. There is no doubt we have responded to pandemic in a much better way than humankind has responded to pandemic. So healthcare, and so there is an acute mortality because of COVID-19. But there is something called post-COVID syndromes, long COVID. People are struggling. Somebody who has COVID has developed lung fibrosis or lung difficulty to breathe. There are increased risk of heart attacks, thrombosis, etc., etc. And some of them develop brain fog. Some of them are unable to think. Some of them suffer from chronic pain post-COVID. So COVID has, in a healthcare system, it has affected every organ. It has impacted in a huge way to human life. Is it that the only impact? No. Just look at the economic impact that humankind has suffered just because of COVID-19. Millions of people have been pushed to poverty. There were people who were starving. We had seen people walking from hundreds of kilometers to go back to their houses in India, barefooted. Why? Because they lost their job due to lockdowns. Those who are affluent can afford, sit at home, watch TV and have food. But those who are working daily basis, they can't do that. So that was another aspect. Social aspect, people were depressed. There were a lot of amount of depression, etc., etc. Because of COVID-19, a lot of people with cancer died. Why? Because cancer care was, because of lockdown, they couldn't get diagnosed in time. So not only impacted, COVID did killed by itself, because of other aspects of impact on other health systems. It killed a lot of people because they couldn't get the adequate care. And last but not the least, we should never forget our children who lost a couple of years of education. It is, for example, children sitting at home getting online education. We have tried to innovate. But how much we could, their social interaction, their social skills is not the way what we have we get from the school. So we teach medical students. So these people who studied medicine during these 2 years, they have suffered tremendously. Their clinical skills, the way they interact with people is totally different. They try to catch up. What I am telling is, we teach people who are 23, 24, 25 years. So if you look at somebody who is 4 or 5 years, the initial formative years in school, they are never going to get back and they can never catch up. So COVID has profound effect on every aspect of human life and we have suffered in a lot of ways. But biggest learning is resilience. We all learned humankind will bounce back in whichever way we have been thrashed. So we have bounced back, we are catching up, and I am sure we will go back to normalcy soon.
Thank you, Dr. Shenoy. Now, coming back to Aravind, who is the head of infectious diseases, Govt Medical College. How can community involvement be maximized in epidemic and pandemic preparedness and response strategies?
It's a very important aspect, as the Mohammed Anish sir did say, the priority for the Kerala Health System Improvement Project is actually One Health. And following this Nipah outbreak and problem with AMR and all, Kerala launched this One Health program in 2021. Probably one of the first states to do so. And phase 1 was targeting the Pamba Basin regions, because in the Pamba Basin is where, we always, every year we have avian influenza outbreaks, and it's just a couple of mutations away that will cross over to the humans. So we start off in the Pamba Basin districts, and the priority was to have community level volunteers, because majority of these emerging infections are zoonotic, and probably if there is some duck death somewhere and the handler, if that person is developing flu-like symptoms, the first alert can come from the community itself. That's the importance of actually having community level volunteers, and we have trained around 2.5 lakh community level volunteers in the Pamba Basin districts, and phase 2 will be we'll be launching in all other districts. So basically we were piloting this community level action at the ground level, and we have very good feedback too. For example, patients developing fever and joint pains, and if they had a cow, etc. at home, now the farmer themselves are coming to the clinic and saying that, you taught us about brucellosis, please get us tested for brucellosis. So the community level engagement is actually a double-edged sword in Kerala, okay, because they become over-aggressive, they may become, sort of hypochondriac, like, all these joint pains, etc. due to brucellosis, etc. But most important thing is, if we want to diagnose infections at the earliest, we need to take community into our confidence. And that is what the One Health program of Kerala is aiming to do.
Now back to Professor Hemant. Madan. Can recurring disease and their management lead to genetic mutation affecting future generation? How should this be addressed?
Of course, genetic mutation is a part of, I presume we are talking of the genetic mutation of the organism or of a human being. Okay. Well, genetic mutation is going to take a long time to be effective. So, if we are counting on genetic mutation as being our protective kind of gear, I think it's going to take a very long time to prevent us. Of course, it can happen. It can happen. I'm not sure of any, probably Dr. Aravind is a better person to answer that, whether we have an example of a genetic mutation taking place in a human being which prevents us from a communicable disease. To my mind, there is none. But, it can theoretically, it can program us. What's perhaps much more important and much more dangerous is the genetic mutation of the organism, which is going to bypass our protective systems and is going to infect us in newer and more advanced ways. Where do I see this pandemic or this entire coronavirus thing going? I mean, I'm going to talk more of corona than of anything else, because that's the only real pandemic that at least our generation of people has encountered. Where do we see coronavirus infections going? We know that it's constantly mutating. It's an RNA virus. It mutates much more than any other organism which infects us. The latest variant is a variant called the flirt variant. And just today, there's a news article in Times of India which says that flirt variant is spreading very rapidly. It quotes an ICMR report, says that it's spreading very rapidly. It's slightly milder. But that's exactly what's going to happen, probably. I mean, that's what my conjecture is, that it will become more of a, a recurring seasonal kind of a thing. It will keep happening, and to counter it, we'll have to keep on modifying and fine-tuning our vaccinations as time goes. It might become a less severe disease as time goes, but I don't think is going to go away very soon. It's going to be more of a recurring problem. Dr. Aravind, I mean, if you have anything to add to this, you can probably add.
I totally agree with you, sir. The evidence with regard to evolution.
Particularly, now there are doubts whether vaccine itself produces a lot of side effects, including mRNA vaccine, whether genetic mutations can happen or what.
Actually, that's not yet proven. But what Sir said, we have example of in African population, some Duffy genes and all protects them from sickle cell disease and malaria, etc. But then the problem is evolution takes a long time to happen.
That's right.
So evolution is not going to help us. Probably maybe our 100th generation from now, the evolution may be able to protect. We need to invest in vaccines. That's the way forward.
There are two controversies which are striking controversies about COVID. Actually, there are three images in my mind, and there are two controversies that I want to touch. The three images in my mind, which was asked earlier, of what strikes you as representing COVID and the disaster that we went through. The first was the image of migrant labor stranded on highways, at least in North India. I'm sure it happened in South India as well. That is the first image. The second was the image of oxygen tankers being stuck on borders because of political misgivings. And the third was floating dead bodies on the banks of Varanasi, on the banks of Ganga in Varanasi. Where the number of deaths were so overwhelming that there was not enough logistic support to dispose of these bodies. So these are three images. If anyone ever tends to forget, please remember these three images, and you will realize what a difficult situation we passed through. There are two controversies about COVID which I want to speak about. The first controversy is about vaccines. Just as Rome wasn't built in a day, no vaccine which comes up over a period of 6 months from the first reported case of disease is ever going to be perfect. It's not possible. See, we are going to, vaccines are going to be fine-tuned over a period of time. Modern science, the biggest kind of achievement has been that they could combine, I don't know how many of you read what goes into making of a COVID vaccine. It's actually marrying two different technologies. It's marrying a messenger RNA from a virus and getting another component into it so that it produces a vaccine. Am I right, Dr. Aravind? It's a two-step process. The fact that modern science, it's brought about by a technology called the script technology. Script, isn't it? Script technology. The fact that we scientists were able to do this in such a short time itself is an ode to, to modern science. Now, obviously, if the virus goes on mutating, vaccines will also need to be fine-tuned. But I think they did a lot of benefit, maybe a little harm. It hasn't been scientifically proven as yet. Prothrombosis, long COVID. So, all these things need to be proven scientifically. So, if you're talking in a scientific kind of a forum, we need to stick to science, and science needs to prove. The other thing, which is the controversy of COVID, is increased thrombogenicity and a syndrome called a long COVID syndrome. Yes, there is some evidence of very unrelated symptoms which patients are left with. Some are left with hypothyroidism, some are left with cardiac problems, some are left with slight propensity to form clots. They are left with, but let me tell you, these side effects are also there in many other viral illnesses. So therefore, let's not go away with the idea that only COVID causes these longish symptoms. There are many other viruses which also cause longish symptoms. Thank you.
Now the last question is to Dr. Padmanabha of Shenoy. How can we address the adverse effects and correct misconception about epidemics, pandemics and vaccination?
That's a fantastic question. I think that is one of the very important questions to understand how to, now we are all living in an era of information overload. We get information from lots and lots of forwards, YouTube, Facebook, and whatever we believe, we tend to keep on getting forwards of making our belief more and more solid, which people call a cognitive dissonance. You have believed something, you keep seeing the same thing, and whatever examples you see, you will make sure that the same thing is happening everywhere. So how to know whether you are misconceived or your concepts are correct? Only ways to do is understand science. That is the only way. For example, I was traveling today from airport to this place. My seatbelt, my driver told me, please wear the seatbelt. I can always tell that somebody else has worn the seatbelt, I will get the fungus from that because that fellow had a fungus. But there has been studies done on this. Is there a chance of developing a fungus from, getting a fungus from there, fungal infection? Yes, there is a chance. What is the chance? 1 in 1 million. But what is the chance that I will save myself from a car, when I develop a car accident because I wear a seatbelt, I will get saved? The chance is very high. There is a study which is done in Australia. There was a rule which was put forth, everybody has to wear a seat belt. There was a 50% reduction in mortality, 50% reduction in mortality. So, what I am trying to tell you is that, because I didn't wear seat belt, my father yesterday did not wear seat belt, he travelled from Kochi to Trivandrum and he didn't develop anything. Does it mean that seat belts are not protective? The basic thing is that we need to have logic and we need to have developed scientific temper to understand that what is science. I am a very, very good proponent of, I like all the systems of medicine, everything. But we have to be very clear, we should not get carried away by what Baba Ramnath told, Supreme Court pulled him up. Because, and we have done, at our center, we have done a lot of research on alternate systems of medicine, some of which is very effective, but it has to be proven. Second thing, what I want to tell you is about vaccines. Regarding vaccines, there are a lot of misconceptions. Let us be very clear, we are sitting in this hall, some of us are sitting in this hall most of us are sitting without mask, because of we had vaccines. If vaccines were not there, our life would have been entirely different. Lot more deaths would have happened. I told you, 1918 swine pandemic, influenza pandemic, 5 to 7% of human population was vanished from this planet. In COVID, before the vaccine developed, we used to see in hospitals lots and lots of sick cases. Now a 70-year-old man, vaccinated man coming to us, he has mild illness. He developed fever, he developed throat pain. It's a very mild illness. This is the message. And all these vaccines are studied. How they have been studied? Some people were given vaccine, some were not given vaccine. 20,000, 30,000 people. They were observed for 4 months, seen how many people died. How many people in the vaccine arm died, how many people in the placebo arm died. The reduction in mortality was above 95%. That's how the vaccines were approved. So this is a message. But the problem is what? Message does not get conveyed very easily. So we need platforms, we need real messengers. Messengers are people who are healthcare workers, who are community leaders, who advocate. 1 in 3 lakh people can get thrombosis if you take a vaccine. But after developing COVID, 2 to 3% of them can develop a thrombosis. 2 to 3% versus 1 in 3 lakh. So all of you know how less is the risk with vaccines when compared to the COVID by itself. If you develop a COVID without unvaccinated people, 1% can die. So with COVID, and despite having such a profound impact on all of us, the COVID vaccine is being criticized that it has been a pharmacological, big pharma company's agenda. It has been a manufactured vaccine. It was not tested. Lot of misconceptions are there. We need to understand, like Dr. Madan said, just remember what we went through during COVID and how our life has changed. And human memory is very short. We all forget. But let us not forget one thing. Science is the only way which has taken us all these years forward. And science will progress. Science is not only modern science or allopathy or anything. All science are equally important, but it has to be in a scientific temper, and scientific temper has to be taken to the forefront.
Thank you.
May I request Mr. Rajesh Sundararajan to kindly hand over the memento to Dr. Padmanabha Shenoy. I would like to request Dr. Satish to kindly hand over the token of gratitude to Professor Dr. Hemant Madan. I would like to request Ambassador T.P. Sitaram to kindly hand over the token of gratitude to Dr. Aravind.